हटाओ यार, कुछ तो इंटरनेट कहेगा, इंटरनेट का काम है कहना. It then becomes our responsibility to filter out the crap and find the right information. And that is exactly what I and Allo Health wish to bring you through the series. Medically accurate information. Hi everyone, I'm Dr. Sakshi Tickoo, my pronouns is she, her. I'm a queer occupational therapist, sexuality counsellor and the author of Sex Care, and together we're going to debunk some common misconceptions around erectile dysfunction, what it is, what are the causes, the treatment options available and more. So let's get into it. Erectile dysfunction or ED can look different for different people. In the medical world, we define erectile dysfunction as the inability to maintain or sustain an erection that is satisfactory enough for sexual intercourse. Okay, now the symptoms or the presentation for erectile dysfunction can vary for many people. For some, there can be a complete loss of erection. For some, there may be erections that are not hard enough for penetration, or some may experience erections that come and go. And all of these symptoms and presentations will depend upon the underlying medical cause, your mental health, lifestyle, and your pelvic floor health as well. However, if you are experiencing any of these concerns on an occasional basis, then it really does not mean that you have erectile dysfunction. However, it's always better to get it checked with your healthcare provider. This is the most toxic myth we have to put an end to. What often manifests or what often shows as symptoms of erectile dysfunction often stem from underlying medical conditions, which can be physical in nature, they can be psychological, or sometimes a combination of both. So it's definitely not all in your head. In fact, erectile dysfunction sometimes can be a symptom in itself and help with early detection of vascular conditions, heart conditions, anxiety disorders, and much more. If only that were true. While the prevalence of the condition may increase with the age, however, given the current lifestyle and especially post-COVID, the incidence rates for erectile dysfunction in the younger populations is also increased. In fact, at least 15% of the population that falls in the age group of 20 to 40 years has experienced erectile dysfunction at some point in their lives. So, erections are a part of body arousal mechanism and not desire. So, desire is the feeling to engage in sex, and erectile dysfunction does not directly impact that. However, the desire to engage in sex might decrease due to anxiety, low self-confidence, shame, guilt, or whatever other reasons there are, especially if you're engaging in partner sex. Viagra did become a household name given the effectiveness of the drug. But to break that bubble for you, it's not the only treatment option that's available out there. In fact, many people do not even need these drugs. All of this depends upon the underlying cause of erectile dysfunction, and a doctor wouldn't just go about giving you drugs and signing you up for drugs. They will first and foremost see and check your other parameters, your overall health, and only then are they going to prescribe the next line of treatment if it involves drug therapy, if it involves psychologist or a psychiatrist or any other mental health care professional, an occupational therapist, a physiotherapist, and if at all, a sex therapist. Hence, there is no one solution. In fact, many practitioners today actually adopt a combination of treatments to improve the effectiveness and the outcomes. So, what can you do? First of all, break the silence and the stigma. Erectile dysfunction is nothing to be shameful about. It does not mean that your penis is broken, it does not mean that it's all in your head, and it also isn't a testament to your sexual performance. It's an extremely common lifestyle disorder which helps in diagnosing other lifestyle disorders or other comorbidities that you might be experiencing. So shutting up about it is actually doing you more harm than you thought it would. If you think you have been experiencing any such concerns, log on to allohealth.care. The link will be in the description. Allo Health is a digital-first health clinic that is designed to improve and empower you in your sexual wellness journey through judgment-free and clinically proven methods. All you have to do is fill a short assessment at the comfort of your home, and then be honest about the concerns and the symptoms that you're experiencing, and let the concerned professional take care of you. It's really that simple. Thank you so much for joining me here today and sticking with me through the end of this video. If you did learn something today, do not forget to like and share, and also subscribe to the channel. We will see you next week to empower you in your sexual wellness journey. Bye-bye.